Hi, my name is Anthony Crisco, inventor of the Fascianator roller and developer of the Fascianator method. Today, I want to talk to you about the neurovascular bundle. What is a neurovascular bundle anyways? Well, why don't I teach you? The neurovascular bundle is when you have an artery, vein, nerve, or lymphatic vessel that travels from the center of the body into our appendages, like our arms and legs. Now, when we have tight fascia in our body, those structures have to travel from one part of the body to the other. In doing so, they have to perforate various layers or sheaths of fascia in our body. Now, tight fascia can actually compress those structures, which then leads to these kind of problems: arthritis, tendonitis, bursitis, muscle atrophy, weakness, loss of balance, loss of proprioception, constipation, lupus, cancer, a whole host of things also that are basically can be from acute down to the chronic levels of disease processes. Now, as you can see in the image here on the slide, your arteries, veins, and nerves and lymphatic vessels have to travel through our body. And I made a little model using a simple loofah sponge. In the image, the red structure is the artery that brings fresh oxygenated blood to the structures. The blue structure is a vein that brings old blood away from the structures. The speaker wire represents the nerves in our body for nervous conduction, as well, and the clear tube represents the lymphatic vessel that helps drag all the old inflammatory waste away from the appendages to be filtered out. Now, if I do have tight fascia, then I'm going to have all kinds of issues, from sensitivity to my skin, edema, like swelling in the ankles and in the feet. I'm going to have muscle atrophy and weakness, a lack of proprioception, and a whole host of other issues that basically lead to dysfunction in our bodies. When you roll the fascia, it acts like a sponge. So similar to the image, if you look at the image on the top, those structures are being compressed. If you look at the image on the bottom, after I soaked that sponge in some water, well, what do you see? The sponge went, and the pressure on the arteries, veins, nerves, and lymphatic vessels has been rectified, thus restoring oxygenated blood flow to the tissues, helping eliminate cellular waste at a higher level, which then reduces the level of inflammatory waste in our body, which, believe it or not, can boost your immune system, because your immune system isn't busy dealing with all this inflammatory waste that's been allowed to fester in your body. Instead, it can focus on healing and fighting external bugs that want to invade your body. Now, let's take a look at the next slide here. Think about this. We all have around 60,000 miles of blood vessels in our body and 45 miles of nerves. Now, can you imagine how many different places in our body could be suffering from neurovascular bundle perforations that are being compressed by tight fascia? Think about it. From your head to your toe, from the back to the front, from left to right. And why is the Fascianator method so good at addressing these issues? Because we roll the body from the bottom to the top, left to right, and front to back. Do you want to become certified in the Fascianator method and change lives every day? Well, click here to learn more. Again, my name's Anthony Crisco, and I look forward to seeing you in person.